Well, hello again, everybody. Welcome back into the Keep Boone Healthy Community Information Channel. I am David Jackson, president of the Boone Area Chamber of Commerce, joined by our vaccination team here in Watauga County. Of course, Jen Greene, director of public health and CEO of AppHealthCare. Corey Furman, the president of Boone Drug Incorporated. Sean Burroughs, the director of pharmacy from Appalachian Regional Healthcare System. I feel like I can't go anywhere without you guys. We just need to be like a quartet, just moving about the county. But one of the reasons for that right now is such exciting news. Yesterday, it was announced that Watauga County will be moving into Group 5 of the COVID-19 vaccination plan as put forward by the state, a full 8 days ahead of what we looked at from the state's perspective as the calendar date that transition would occur statewide. So first of all, on behalf of the entire community, thanks to all of you and the teams that you have working on this for getting us to this point so quickly. A lot of efficiency has been brought forward in our community by you all working together and working so hard in your unique areas to get this vaccine out in our area. So first, tip of the hat to you all for making this happen. But I guess Jen, more maybe kind of the story of it all. How did we get to this point so quickly and be able to reach this level ahead of the rest of or a number of counties within the state?
Well, I think a lot of it is attributed to the fact that we've got such good partnerships here, and we have some committed folks putting out vaccine as quickly as we can. We've worked together to put on some events, and a lot of folks have come out to those, and so that's helped us move through our groups a lot quicker. We've put in some extra requests to get additional vaccine to our area, and I think that, along with our coordination and the work of all of the vaccine providers, has really made the difference here.
So with that said, and we'll let everybody go around the horn here and talk about operationally how this new availability to everyone will change things. But I think that we've been waiting for this moment, Jen, of not having any parameters, no slide rule to see if you fit in a certain box or a certain category. I'm sure that obviously opens up a lot of positives. How do you view the groups 1 through 4 now within this? Is there any prioritization for previous groups, or is it just pretty much first come, first serve at these sites and through these providers for the rest of the foreseeable vaccinating future?
Well, we're still trying to stay open with employers and other groups and making sure that, groups 1 through 4 still get some priority. But I think in general, we're just trying to get as many people vaccinated as quickly as we can without as many parameters. So we're excited about that.
And overall, what's Watauga County's progress looking like in terms of total vaccinations? What are you seeing from that standpoint?
Well, our vaccine dashboard is showing some more good progress. We're at 26% of the population that's been partially vaccinated and 20% that's been fully vaccinated. And we know that those numbers always lag behind. So we're actually probably further along than that, which is really exciting.
Great news to hear. And as Sean, as we talk about this from the hospital system's perspective, I know both you and the health department have been at this from the very onset and working the kind of scheduling magic with interest form followed by phone call. I know a number of people have received those now that are getting ready to move into Group 5. That Group 5 group got the phones buzzing yesterday. So with that, as we start this around the horn approach here, can you tell us a little bit about how that operationally will now change within the way that you all have been scheduling vaccination appointments now? What can people expect to see from the healthcare system in that regard?
Yeah, it's a similar process in that you go onto the website and fill out your information, but it's more of a, it's more of a, if you want an appointment, you can sign up for one now, as opposed to filling out the interest form and then waiting for a phone call or an email to say that, your time is now and you can schedule your appointment. The way it's going to work is we're still going to ask for that information, because if we end up getting more vaccine supply first doses than what we thought we were getting and all of our schedules booked up, we may open up some more slots. And if we open up some more time slots, we'll send out an email letting everybody know that's on that form that, hey, there's more slots open right now so that you can jump in and sign up if you want to. But as far as going onto the website and signing up, it's going to be easier because there's not going to be, do you have these health conditions? Are you this age? It's basically, you can just sign up for an appointment if there's one available.
Great news. And Corey, I know that Boone Drug has been kind of operating like this from your start in administering vaccine yourselves through a couple of different programs. Can you tell us a little bit about, number one, the success that you had getting this into the store level? I know that was something we talked about last time, but how you will work to balance out what kind of vaccine you've got available and where people might be able to go and get that from your locations.
So we, because we have both federal and state suppliers to Boone Drug for the vaccine, we're receiving many different types of vaccine. And that's true, not just to Boone Drug, that's everywhere. And so what we do is we, in order to try to prevent us from having to offer multiple types of vaccine on the same days at the same location, we will put one vaccine at one of our stores on a day, and then at another store, maybe another type of vaccine. And then at our large clinic site out at Mount Vernon Church, another one. So I know next week we're going to be having Johnson & Johnson at 4 of our store-based clinics. We're having both Moderna and Pfizer at the Mount Vernon site this week on different days. And some days we're doing first dose clinics, some days we're doing second dose clinics. And the way to know all of this is if you go to boonedrug.com, and when you're there, you click on the site and it tells you, where do you want to go to get your vaccine? Do you want to go to this store or this store? And then under each one, it's going to tell you, this store is going to be having Johnson & Johnson on this day. This site's going to be having Pfizer on this day. And that way you can go through and you'll know exactly what it is you're signing up for. And then if you're getting Moderna or Pfizer, then we have it set up for you so that when you come in to get your vaccine, your first dose, we automatically go ahead and schedule you for your second dose, so you're taken care of. Now, obviously with Johnson & Johnson, that's not a concern.
Great points, and appreciate your willingness to share all of that and in such a concise way so people understand exactly how that process works. And especially, and Jen, I'll ask you this first before you get into your operational parts, but we know now that there are some different parameters to different vaccines. At the very onset of this was, hey, put in my arm whatever I can get in my arm fast enough. Now, because of age, some people may need to see Pfizer first, especially those younger frontline service workers. Some people want the one shot, so that obviously sends them toward Johnson & Johnson. But do you foresee continued flexibility and increased ability from state partners, at least, in getting more of each of these? So kind of to Corey's point, you can spread things around a little bit more and have more availability. So folks don't feel like they've got a vaccine shop so much. They know that, hey, on a day I can go here and get this one, I can go here and get this one. And it's not so much, well, I want to wait for this particular shot. I might have to wait 2 weeks for that one instead of going tomorrow and getting another one.
I think we're going to see more vaccine supply in general. We've been sort of waiting for the supply to increase across the board. And I do believe that we're about at the point where we're going to see that. Right now, the state is getting a certain amount for Johnson & Johnson. I know that's one that people have interest in. And we expect to, have more of that available at the state level, which may lead to more regular shipments coming out. That's what we expect later in April. Right now, what we're doing is we're making special requests to get some of that vaccine in our area for more of us to have access to it. So I think, folks just need to be patient. And also, I'll just add, the MMWR, which is sort of our a public health guidebook in a lot of ways. It's the Morbidity and Mortality Weekly Report that goes through CDC. They published a really exciting article this week about real world effectiveness of the vaccines. So, I encourage folks to just know that no matter what vaccine, all of them are effective. Of course, if you are 16 or 17, the Pfizer is the vaccine for you. And we're so glad that Corey's team at Boone Drug has got some of that. And we've got a link actually on our website so that folks can find the quickest access to that vaccine as possible.
Yeah, and Corey, if you wouldn't mind touching on that for a moment too, you're getting supply out of a couple of different programs, which I think again speaks to the flexibility that bringing new partners in can deal with, not only the state but you're also part of a federal program. Can you give us just a little quick hit on how Boone Drug's been able to position themselves to benefit from both?
Yes. So the federal program in the state of North Carolina still, it filters through the state. So it comes from the federal suppliers down to Raleigh and then spreads out from there. Now, for one reason or another, and we're not privileged to know this information, the federal suppliers made the decision that in the state of North Carolina, they are going to be providing the Pfizer dose through the federal suppliers to Walgreens only. And so Walgreens was the only pharmacy that was receiving this from the feds. The Boone Drug, we through a good deal of lobbying and phone calls and just doing everything we possibly could to try to get more vaccine to the high country, we were able to convince the federal providers to allow Boone Drug to be on that list. So right now in the state of North Carolina, if it's coming from the federal supply, it goes to Walgreens or it goes to Boone Drug, and that's it. So we were very pleased that we were able to be counted on that list. So we are able to get an additional supply on top of what's coming from the state to supply to the high country to help get these numbers up. And so part of the reason that was allowed was because of the statistics that we're seeing coming back to the feds from what Jen and Sean have already been doing. So the feds were able to see this and they said, wow, what an efficient county. This is doing very well. Let's get more sent up there. So a real pat on the back to them through their efforts of everything they've been doing in this county. That allowed it easier for Boone Drug to apply for this and have it sent over.
Well, thanks for that explanation, and that leads perfectly into the next question for Sean here. And Sean, I know with that, one of the things that we have touched on through these routine updates is that by playing by the rules and making sure that you're serving the right people when the right category was up, and you were getting as much vaccine in arms as you possibly could, maxing out that stash each time that it was delivered to you, that you would be in the state's good graces, so to speak. You wouldn't be seeing supplies go away. Rather, you would be a trusted partner to see them coming forward. So, I know that that's a big part of this, but you've also been chiefly involved in running one of the most efficient sites that any county in Western North Carolina has seen, with having the Watauga County Recreation Center be as expansive and giving you the room to operate. Do you foresee that facility still being kind of the epicenter of the health department and Appalachian Regional Healthcare's vaccine efforts, and how do you foresee that facility being used even more as now we're getting into this larger group?
Yeah, I mean, the county has been so gracious to allow us to have that one large gymnasium that we've had, and sometimes have had to spill into the other one. And I know that towards the end of April, they are going to open up the rec center, but they've mentioned that they are going to continue to leave that one gymnasium available for us to use. And without a doubt, at least from our perspective, we would not be anywhere near the number of vaccines that we've given as easily as we've been able to without using the rec center. So big props to the county for letting us use it up until now, and then continue to use it as we need to until we are able to get through all of the folks that want a vaccine here in the high country.
Well, and I know just thinking about high volume and how that facility lends itself, saw obviously a number of Watauga County school system teachers going through there on Friday and getting their second doses, and that group, as large as it is, moving through as quickly as they did, was certainly another indication that that a well-placed facility with flat parking and lots of it and sidewalks for people to queue on certainly is helpful at a time like this. So thanks for all that you have been doing to keep that site running as efficiently as possible. Jen, I know we've got a new partner in this mix that has been coming more to the forefront over the last few weeks, and that's Appalachian State University. They have been working within the university community some with a vaccine site that they've got on campus. But can you talk a little bit about how they will now enter into this? They're like the new member of the Beatles coming in to this conversation here amongst vaccine providers. But how will they be engaging with the community moving forward?
Well, I think that, a lot of things happen behind the scenes, and the student health service and emergency management teams there at the university have been working on their vaccine plan for some time. But we're excited to see them join in. They are getting shipments of vaccine routinely. And though I think they're focusing a lot on their population, I don't think that they're closed off, and they're certainly open to some community folks coming to get their vaccines. So we're really excited to have another opportunity for people to get vaccinated. I know this week they're doing some bigger clinics, and I believe they were getting 2,000 doses. So we're excited to see them helping out, because I know a lot of us want to see more of the student population get vaccinated before they go home. And they're a big part in helping us achieve that goal.
Yeah, and that kind of leads into my last point for you, Jen, as we look at what comes next now. We've been so conditioned to just be in this wait and see, get some more information, wait and see. Now that we're into this group 5 and the state will be catching up here soon. We have seen so many rules come out within vaccine groups. Do you foresee any kind of pivots by the state to make group 5 any more than just the call for everybody to come or not? Or is this pretty much going to be the end of so much, weekly news about vaccine deployment? Will this be a pattern that we'll see for the rest of the summer, potentially, that people can begin to understand and work into their daily schedules and lives for that matter?
Yeah, I think that really what we're going to see is more attention to how are we doing. So I mentioned earlier, we're at 20% of our population, and that's great, but we want to keep going. And so I think we're going to see more focus on maybe not so many restrictions, but how are we doing in terms of, are we reaching our target population? How are we doing in terms of equity? Are we really reaching those who are most vulnerable in this in our communities, and how are we maybe potentially approaching things differently? I mean, I think all the vaccine providers are really going to be encouraged to try to make sure that they are thinking about health equity and reaching all of our population. That may take a little more effort to go out and connect with our community. And, one of the groups that we've been working on, I think several of us are taking vaccines to people who are homebound, and that's a real important need too. So we're going to see more focus on that, as well as trying to make sure we have a good in-reach in our community.
Well, this is all very exciting news. And again, lots of hard work put in by all of your staffs. And we won't forget Alice Salthouse over at High Country Community Health, and certainly having App State in this mix now too, to have the 5 of these agencies working on behalf of Watauga County citizens and doing this as efficiently and as effectively as possible. We can't thank you enough for doing what you're doing. The CDC document that Jen mentioned a moment ago, if you're watching this video through your chamber report email, we will share that link underneath this video for you to read a little bit more about that. I know that there are a number of employers that still continue to contact us and other partners throughout the area about ways to share information about vaccines to their employees who might be making that decision. So anything that we see like that can be helpful to you in that regard, we'll continue to share as we go through this process. So I know you all have a very numerous demands on your time. So thank you for, again, spending some time with us here this morning and getting this exciting information out to our community. And I am sure we will be back together here in Zoom land again soon to update progress and any operational changes that you all have as to how you're doing things. Know that we'll be here to help you get that information out. So thanks again for joining us here today.
Thanks, David.
Thanks, David.